The Ebola outbreak was confirmed in Mubende district on 20th September. According to the Ministry of Health spokesperson Emmanuel Ainebiona, of the 21 cumulative deaths recorded so far, 4 are confirmed for Ebola, while 17 are probable and still under investigation. 34 cumulative cases have also been recorded.
And 16 are confirmed, whereas 18 are probable cases. That means these are not tested as yet.
While the ministry is still investigating the suspected case in Kansanga, it has dismissed social media reports that there are 6 suspected cases in Kampala.
There was a sample collected from a suspected case from Kansanga. We're still waiting results from Uganda Virus Research Institute.
With the number of Ebola cases climbing, Uganda Medical Association believes that it's time government thinks about constituting a gazetted team to address the outbreak. According to the association president, Dr. Samuel Oledo, there are over 2,000 unemployed medical officers whose skills can be put to good use.
So at the end of the day, we are a nation which is starving amidst plenty. It is high time we recruit massively, and we have a team which is specifically for the Ebola treatment unit.
But of critical importance, according to Dr. Oledo, is the provision of important resources to all medical personnel involved in the fight against Ebola to ensure that their lives are not put at risk.
Meaning, at level 1, level 2, and level 3, we must have fully braced up health workers to see any suspected case before they give the medical appropriate treatment. Even at triage. This is not COVID-19 whereby you wear a mask and gloves at level 1 at triage and you're good to go. You must brace up.
Dr. Oledo also urges government to start thinking of imposing a travel ban on Mubende and neighboring areas in order to control the spread of the disease. As government races to stem the Ebola outbreak, organizations like Uganda Red Cross Society have placed their boots on the ground to provide support.
Actually, we've already activated the team that should be doing surveillance in communities, because the biggest trouble was now contact tracing. And the ambulance teams yesterday at least were able to evacuate 5 suspected cases. And then today they have so far evacuated 4, and these are probable cases, but of course with signs and symptoms.
Another team is on standby to handle any possible outbreak in Kampala and the surrounding areas.
Signs and symptoms of Ebola include high fever. You can have general body weakness, vomiting, nausea, headache. But mainly it is fever. Then you can have bleeding from your body openings. You can have blood in stool or blood in urine, and bleeding from other body openings.
Joyce Nakato, NTV Weekend Edition.